Clinical decision support systems in healthcare, role and impact. Background. Clinical decision support systems, CDSS, automatically generate data-informed alerts and reminders for prompt clinical decision-making and intervention. I have seen a CDSS integrated with EHRs to flag hypertensive cases at a hospital. It included blood pressure self-monitoring devices, which sent data to patients' EHRs, assisting pharmacists and nurses to monitor treatment response and safety. I have also seen a CDSS for measuring blood glucose in patients under intensive care. This system alerted nurses to potential hypoglycemia cases, requiring them to use a local glucose monitoring protocol for further assessment and treatment. Predictive analytics for diagnosis or intervention. Current predictive algorithms help identify people at a higher risk of disease for diagnosis or intervention. They use data from different sources, including EHRs, clinical imaging, and national registries. For instance, FRAX is a free predictive tool for hip fracture risk, which has been included in online apps for routine clinical use. Proprietary algorithms are also available for diagnostic use on a fee-for-service basis. Calster et al. Also identify a biomarker-based tool approved for the diagnosis of ovarian cancer to aid in early treatment initiation. Thus, this predictive algorithm has the potential to improve the health of high-risk women. Errors in clinical decision support systems. CDSS have great diagnostic value but are not foolproof. The errors may be difficult to detect given the complex decision tree-based models used. CDSS integrated with EHRs generated alerts with conflicting advice on nortriptyline dosage for a patient with a disease and liver failure. This error stemmed from the system's reliance on one or two parameters to generate automated warnings. Further, changing drugs in the system or their classification system also caused the system to malfunction, generating inappropriate suggestions and many alerts that disrupted clinical workflow. Therefore, errors may be inadvertently introduced in CDSS by changing prescriptions or rules. Initiating the system. The CDSS is first integrated with EHRs to ensure a seamless clinical workflow. This integration will also promote access to the organization's datasets for the system to provide patient-specific diagnostic or treatment support. A protocol for reminders, automatic alerts, emails, and pop-ups must also be established and linked with provider devices. These decision-making aids must be used according to local clinical rules to avoid disrupting workflows. Recommendations. 1. Provide large, curated data to avoid costly CDSS errors and wrong clinical decisions. The data repository integrated with the system should be checked for accuracy and conformity with informational standards to prevent system malfunction. 2. CDSS should be regularly updated to reflect changing medical knowledge and practice guidelines. 3. Several parameters should be combined to generate one alert rather than multiple inappropriate reminders. This approach will help reduce the number of automated warnings, which could cause burnout. And finally, 4. CDSS should be integrated with human workflows and other systems, including EHRs, to avoid disruptions. Analytics data. For clinical diagnosis, EHR and biometric data should be considered in predictive analytics. These datasets may be used to build models for predicting the risk of disease in asymptomatic individuals. Unit data on the average length of stay should be considered to predict hospitalization duration for new patients based on their present symptoms. The predicted changes in the incidence of chronic diseases would also indicate the additional resources required based on the anticipated needs of patients.